Good morning, everybody. We will just give it a few more minutes as folks are signing on and joining us for this morning's webinar. So thank you, and we'll just hold tight for a couple more minutes here to allow folks to get online. Give it about 30 more seconds. The attendees keep ticking up here, so we'll just make sure that everybody has a chance to get signed on. But thank you for joining us today. Right. All right. Well, I will get us started. Good morning, everybody. Welcome to our webinar this morning that is focusing on advancing the Accessible BC Act, a community belonging project that is sharing recommendations for all municipalities. Next slide, please. So my name is Vanessa Manuel. I'm the Executive Director at BC Healthy Communities Society, and I'm pleased to be co-hosting this webinar today with Sundance Topham, the Chief Administrative Officer with the City of Powell River. Sundance, I'll hand it over to you to introduce yourself.
Great. Nice to meet everyone virtually this morning. Looking forward to working with Vanessa to present this really interesting and informative webinar for everyone.
Next slide, please, Pat.
First off, we would like to gratefully acknowledge the traditional and treaty territory of the self-governing Tla'amin people on which this work took place. We also extend our respect to all First Nations whose territory you are joining from today.
Excellent. Next slide, please, Pat. Perfect. Okay, so just a few housekeeping items before we get going any further today with our presentation. We're anticipating the presentation today will be somewhere around a half hour-ish, and then we will be following up with a question and answer session that Sundance and myself will moderate. So we kindly request that you please use the Q&A feature at the top of your screen in your Teams webinar. If you can't see it, you might need to make your window just a little bit bigger, but it is beside the chat feature. And if you can focus on using the Q&A section, it just helps us stay a little bit more organized. Feel free to pop your questions or comments in there throughout the webinar, but we won't be addressing anything until we get to the Q&A section or session at the end portion of the webinar. So feel free to pop them in as they come to mind, and know that we will be coming back to those at the end. Another note is that we do record the session, and it is being recorded right now. It will be made available to everybody who registered for the session via email, likely tomorrow or early next week. It will also be available on the BC Healthy Communities website and our YouTube site. So like I said, that link to the video recording will be sent out via email. And you're welcome to share this with any partners and colleagues. And there will also be a few additional resources that will be circulating afterwards as well with our information sheet. Another part is that we really like to get your feedback afterwards, and we have a very short survey prepared, and we kindly request that you complete this at the end of the session. And really, it just helps us know what our partners enjoyed, where we might be able to improve for future webinar delivery, or any other feedback that you might have. So that will be in the chat following the webinar during our Q&A session, and also emailed out. So please, if you could, participate in that. And another thing, as we move in through technology, there are typically a number of AI recorders, and some of those we know join automatically. We request that you do not use your AI recorder if you have the option. As I said, we'll be making the session available afterwards, so there's really no need to. And our team will just remove any that we see automatically pop in. So with that, I'm also joined by a few of my colleagues today here with BC Healthy Communities who are supporting in the background here. So Pat is running our slide deck for us, as you hear me ask to advance the slides. Gurmeet, Alyssa, and Erica are also all behind the scenes too. They'll be keeping an eye on the Q&A as well as the chat feature. If anything pops up, do please send them a note, and we'll be watching that. So, and with that, we'll go to the next slide, please, Pat. And just quickly, a little bit about us with BC Healthy Communities. We're really pleased to be offering these sessions. We're a team of planners, public health specialists, community engagement practitioners, and we really intersect at that intersection between planning and public health. We're a province-wide not-for-profit organization, and we facilitate ongoing development of communities to make it easier for people to be healthy and well. Our organization has been operating since 2005, and we really strive to promote ongoing development of healthy, thriving, and resilient communities. We provide a range of resources, programs, and funding. I think probably the ones that most folks know about are our Age-Friendly Communities program, as well as Plan H, but other resources and tools we also use to support to multi-sectoral groups across the province. So we're really pleased to be partnering with Vancouver Coastal Health, the University of Victoria, and the City of Powell River today to share this presentation. All right, and next slide is over to you, Sundance. I think if you're there, Sundance, I think you might be muted.
Sorry about that. I'm having a bit of a tech issue here, but I'm back here. So it is my pleasure to introduce our presenters today. Tabitha Bergen is a project advisor of the Community Belonging Project and has been part of this initiative since its inception. Also joining us is Jason Gao. Jason is the Director of Planning Services for the City of Powell River. And also joining is Hugo Wu. Hugo is a planner for the City of Powell River as well. And they were all intimately involved in this project and are going to be able to provide really good insight in terms of the origins of the project and how it all played out for the city moving forward. And I'm ready for next slide.
Great. And over to you, Tabitha.
Thank you. Thank you, Sundance and Vanessa, for the introduction. So as mentioned, my name is Tabitha Berggren, and I am a project advisor for the Community Belonging Project. I've been involved since the inception, and I am also a mother, I am a teacher, I'm a student, and I'm just really grateful to be here today to share my experience as we've moved through this really important piece of work. And so today we're going to begin with the background and purpose of the project, followed by an overview of the Community Belonging Project itself, the process, the findings, and what the final recommendations are out of all of that work. So we're really hoping, and you're welcome to take these findings and recommendations with you into your own work to apply them or adapt them for your own communities. Our hope is ultimately that all children and families with disabilities are able to participate and be included no matter where they live. And next slide, please. So first, some background to the project itself. Effective September 1st, 2022, under the Accessible BC Act, all local governments are required to establish an accessibility committee, an accessibility plan, and build tools to receive feedback on their accessibility. Also in 2022, 3 of our project members contributed to a provincial report called I Just Want to See My Child Thrive, Parents Pushing for Equity and Inclusion in the Childcare System in BC. And one of the things this provincial report was that children who are excluded from childcare on the basis of disability are often excluded from other opportunities as well. A subsequent literature review found that addressing systemic ableism requires community-based approaches, because the evidence shows that addressing systemic ableism requires a community-based approach. Our team reached out to the city of Powell River. We were really warmly received, and we entered into an MOU on November of 2023. The MOU stated our purpose was to provide evidence-based knowledge that can be meaningfully inform the City of Powell River in the development of its official community plan and in the involvement in the Accessibility and Inclusion Committee. Next slide, please. Okay, so we need to acknowledge kind of the 2 big pieces here, funding and support. So the project was made possible by the BC Healthy Communities Child and Wellbeing Fund, which was provided by VCH, one-time only VCH Health Promotion and Capacity Building Grant, research funding from the University of Victoria, as well as a really stellar research practicum student, and in-kind research support from doctors Janet Newberry and Allison Gerlach. So thank you so much. It's been an honor and a pleasure to be able to participate in this project, but without funding, we wouldn't have been able to get as far as we did. Next slide, please. Okay, so our team and purpose. Upon entering into the MOU to formally initiate the Community Belonging Project, we started by developing the project team. So our project team consists of project advisors with lived experience, either as individuals with disabilities themselves or as parents and guardians of children with disabilities, or both, truthfully. So the project advisors are myself, Cheyenne, and Frankie McWade. The researchers include Janet Newberry, Allison Gerlach, Morgan Skinner from UVic, and we were supported by Mariko Kubota as the Senior Policy Lead in Population Health at VCH. A really dynamic group. It was really fun for us to all get together. The purpose of our work is to better understand how ableism persists systemically in order to support the participation and belonging of young children with visible and invisible disabilities and their families living in our region. Next slide, please. Okay, I'm going to pass it over.
Thank you. Sorry, I jumped on you there. Good morning, all. My name is Jason Gam, I'm the Director of Planning Services for the city. And I am going to speak a little bit about the process from the city's perspective. As a first step, we provided an overview of the departments that the project team should engage with to interview. These interviews enabled the project team to better understand the context in which staff are operating and hear their perspectives firsthand. To support the environmental scan, the research team was also provided with city policies as well as programs and service documents. In addition to these internal sources, the environmental scan included external sources such as relevant legislation. The city's planning team met with the community belonging team at regular intervals throughout the initiative to discuss its status as well as coordinate and support presentations made to our council. And at times we had to pivot, and having regular points of contact made this possible. Speaks to the benefit of living in a smaller community. A lot of us knew each other, and so it was easy to come together and connect on a regular basis when needed. I'm going to hand it back to Tabitha.
Next slide, please, Pat.
And so one of the opportunities that came up through early and ongoing conversations with the community belonging team was the hosting of a policy impact forum. This was a full-day event with attendance by staff and senior leadership across the organization and across different departments that were engaged as part of this project. And so the purpose of the day really was to provide staff an opportunity to share their inputs on the recommendations, to hear back from the project team on some of their preliminary findings, to provide feedback on the applicability of the recommendations, and also just to share some of their perspectives and their experiences that they've encountered through their day-to-day work. And so on your screen, you'll see some of the questions that were posed as part of the policy impact forum, and they include, is anything missed or misrepresented? What is already working well? What is within reach? What is aspirational? And what are the conditions required to get there? Another quote you'll see on the screen is a quote by our former CAO, Lisa Bopalsing, who said at the start of the policy impact forum that I'm looking forward to what we can do to make this a place where every resident, no matter their age, gender, or ability, can thrive. And, she was a really big champion of this work. Next slide, please.
Okay, so the fun stuff, our environmental scan. So now that we've kind of gone through the overview of our process that led to the findings, we're going to shift to what these findings and the related recommendations are. With the documents provided by city staff and external legislation and reports reviewed, our project team came together and conducted an environmental scan. So a large number of sources were reviewed. The full list can be found in the appendix of our summary report. However, here are a few of the highlights. So this is laid out really well. The visible check marks are obviously where disability is mentioned, where children are mentioned, and where disabled children are mentioned specifically within the source material on the left of the box. And you can see the biggest piece here that stands out to me and stood out to all of us is that disabled children are not mentioned in any of the plans that we referenced as source material, which is of concern because this key finding indicates this invisibility of consideration of children with disabilities in any of these central sources, which contributes to invisibility, generally speaking, in other areas as well. Next slide, please. So what do we do now that we have this knowledge? Understanding the systemic nature of ableism and exclusion, we need to bring the whole system into our approach to present it. So on this slide, you can see we've gone through this method on the right of the 6 conditions of systems change. And we're focusing mostly on structural change as being like a big piece of how we shift away from ableism that are embedded into structures that we have to operate within. And so there's some really great, on the left side, we've got 1 to 7, the numbers here. So we're looking about values and assumptions, being more deliberate about language choice is really imperative as well, making disability visible, and planning for equitable community engagement. There's so many pieces here that are dependent on people, right? So 5 is that we need to train people to shift the culture. Systems are still dependent on the people that operate within them and uphold them, whether knowingly or unknowingly. And so when we're able to train people to shift, then we can go into 6, which is explicit changes. And there's lots of pieces and nuance in there. It's a large bucket of work. but the core 6 pieces we identified were built environment, services programs, information and communications, customer service, employment and staff engagement, and governance policies and bylaws. So folks can only do so much in the frameworks they're operating within. So that's why governance policies and bylaws is also a big focus for structural change. And my favorite, number 7, is return to the top and support ongoing learning. So it's the cycle, right? We're looking to continue this work. It doesn't end. It's not like a check 1 through 7 off and then the work does not move forward. We're really intentional about ensuring that our findings and recommendations contribute to ongoing learning. Next slide, please. So a brief overview. So oftentimes when change is being pursued, we focus on the top layer, and usually it's a focus on practice, sometimes on policies, and if we're lucky, we all know this, resource flows, right? So adding money or adding people. However, research does show that if we only focus on these explicit changes, that change is unlikely to occur. And if it does, it's unlikely to last. So we have to start by being clear about our values and assumptions. And that's the bottom of the pyramid of mental models. Working towards a shared understanding of what we're committing to, we can work together to ensure that we use language that upholds these commitments. So for example, belonging is not a special need, right? So speaking about accessibility and belonging rather than special needs places the onus for change on the organization itself, rather than individual residents who may be accessing services, which is a really powerful shift, because invisibility of children with disabilities and their families was central to our findings. And so through language, signage, and other signals, we can make accessibility visible in all that we do. And that's what step 3 is on this slide. So we're now working in the middle row here, make disability visible as number 3. When it's visible, we then still need to plan, right? We still need to enter into that ongoing and cyclical learning. And planning for equitable community engagement looks like those that are most impacted by decisions being made can meaningfully participate and be heard. We also need to train people to work in ways that uphold an inclusive, dignity-centered, and respectful approach to service delivery. Service delivery is often like the first layer of interaction that folks have when they're moving through these bigger systemic frameworks. And we also found many of the barriers to access are actually attitudinal and behavioral. So the importance of the relational layer of this influence cannot be overstated. Next slide, please. Okay, so at this point, we have a strong foundation that is deeply informed by people with lived experience themselves. So we need to move to the top row of explicit structural change. So that involves policies, practices, and importantly, adequate human and financial resources to implement changes. Our final step here, number 7, is to foster a learning orientation in our workplaces by building in opportunities for regular reflection and refinement of our approach. So we're not looking for perfection here. It's about ongoing growth and learning and continuing to do better based on experience, which does require that self-reflexive practice and creating a feeling of safety for staff to be able to share learnings and to be able to grow within their personal practice and the structure of the organization's practice. So the project summary report is organized around these 7 steps and includes specific recommendations for implementing each of them. We do have a lot of detailed examples under number 6 for make explicit changes. We found it to be really integral foundationally. So the Accessible BC Act is an important reminder that all children and families who live in our communities are entitled to access the services that cities run, but not all of them can. So it's our responsibility to do what we can to ensure equitable access for everyone. Next slide. Okay, so our implementation recommendations for the City of Powell River. The we're looking to collectively be responsible to do what we can to ensure equitable access for all. And so everyone is coming to this work from a different place. And based on where the city of Powell River was at the time this project concluded, these are the specific recommendations that were made for them on the basis of this work. So a culture shift, as is outlined in the summary report, operational changes that are not grounded in explicit values-based commitments are not likely to be effective or lasting. A culture shift away from ableism can be supported by clear interdepartmental direction that explicitly and consistently expresses a commitment to accessibility and belonging, and language that reflects that commitment. This enables staff in their various roles to be empowered, right, and to make decisions that uphold the direction being provided at a leadership level. Second point is operational changes. So the summary report includes a wide range of operational recommendations, and some of these involve infrastructure. So like accessible and fenced playgrounds, setting up public spaces in a way that enables access for mobility aids. And some involve making information accessible, like on websites and through signage. And some are about service delivery. So training about how to communicate and engage with diverse clients, offering sensory-friendly options for programs, and partnering with local agencies to provide direct support. Ensuring that there's realistic staff and client ratio and reducing staff turnover so trust can be built and maintained. Many of the recommendations in the summary report are possible already without like dramatic systems level change involved in increasing human and financial resources. And starting here at this time of fiscal restraint is a really good step. Supporting staff in all departments to be trained and to implement relational and communication related changes in daily operations, they can make a big difference that on its own. And so finally, systems level change. There are 3 areas in which the city of Powell River is already embarking on system level changes that should be done in a way that's informed by this project, as to not inadvertently replicate ableist exclusion. And these are the comprehensive policy review. Comprehensive policy review, it can ensure that current and future analysis for accessibility and belonging are applied, which would contribute to consistent and inclusive approach to work across departments, like providing that framework for staff. Community engagement strategy. So the lack of a clear strategy to engage residents on matters that affect them has led to public relations challenges in recent years. And the summary report identifies ways such a strategy can and should be designed with disabled people and others who have been historically marginalized in mind. The recommendations should inform an equitable strategy for the city to engage residents. And finally, the official community plan renewal. So the renewal of the official community plan is forthcoming, and the findings in our summary report can be an important lens through which this entire renewal takes place, as it has implications for all city-run operations. Next slide, please. Okay, additionally, 2 of 2, we're almost there. There are recommendations here that relate to sharing the knowledge gleaned from this project throughout city departments, throughout the regions, and as we're doing here today with others throughout BC and Canada. So knowing that the work we're doing is about systemic equity, continued engagement, and advocacy, it's going to be needed over time and at various levels. Next slide, please. Okay, I'm going to pass it over to Jason and Hugo.
Thank you, Tabitha. And so based on the learnings and the research that was done as part of this project, 3 deliverables were received by the city. They include a summary report, a client services handbook, and a video by the Diversa Collective. All of these resources are available and online currently through the University of Victoria Library website and on YouTube. I believe links to that information and to those resources will be provided by BCHC in a follow-up email after today's presentation. and webinar. And so just a quick summary on each of the 3 deliverables. The summary report is intended for use by organizations that are looking to commit to implementing community belonging through their operations. And so it has information on legislative context, relevant statistics, on the progress being made to ensuring equitable access and opportunities are provided for children with disabilities and their families. It includes information on, as Tabitha had mentioned, examples and how we might be able to kind of move forward and implement the recommendations that were addressed in the previous slides. And it also includes links to various additional information and various resources. The Client Services Handbook is a resource that's intended for use by staff and those that are interested in equitable approaches to community engagement. It's made to be user-friendly, and it includes a one-pager that provides details on inclusive access and service delivery. And so I think that's a great resource that you can have up and set up close to staff workstations. And finally, the third deliverable was a short film that was produced locally in partnership with the Diversa Collective, which is a local media production company. We're super grateful for the work and expertise that they provided as part of this process. And the purpose of that video really is just to continue fostering these conversations around advancing community belonging. And so again, these resources are available online and will be shared with everyone on this call very shortly. And so this concludes our presentation. I will now turn the mic over to Vanessa and Sundance to kind of guide us through and moderate them and questions from the audience. Thank you.
Amazing. Thank you so much, Tabitha, Jason, and Hugo for presenting to us today and sharing your processes, your learnings and understandings, and then how that translates to applications within community. So we really appreciate you taking the time to share with us. And so with that, Sundance and myself, we're happy to moderate any questions that start to come through. And I'm just spotlighting us too, so that we pop up forward here. So great. And as Hugo was saying, those resources and links will be provided in the follow-up information sheet, and that will be sending through. So Pat, I think we can move to the next slide. So I have a question to start us off with, and it could be really posed to all 3 of our presenters today, but from different perspectives. But what were did you experience any unanticipated challenges at all, or on the flip side of that, any unanticipated supports and wins and positives throughout this process?
Yeah, I'm happy to offer my thoughts on that question. I think as a parent, I've come into some nuances and some challenges. And as we were entering into this space, I was really pleasantly surprised by how many folks were really keen to improve their practice. They were asking for resources, and there was an uncertainty of how to approach increasing accessibility in personal and systemic workflows, but everyone was so open to feedback and eliciting feedback and wanting to improve that it really gave me hope. And I felt extreme gratitude for the folks that live in our region and work in our region, because it was just, I really thought there would be, I guess initially I was maybe pessimistic, feeling a little bit like, okay, we're going to have some pushback, but people were so keen to be better and to want to learn. And it was just such an uplifting kind of overall experience for me to engage with. And yeah, I think that was the biggest takeaway.
If I could, I would add that, and specifically as it related to the Policy Impact Forum, this was the day-long event held by that city staff attended. It was really delightful to kind of engage that day and see how interested city staff were in improving processes. I too was not sure how it would be received when it was initially presented, but I was really thrilled to see that, you know, all on staff were just excited to be invited and to be able to share the stories and experiences they've had, and were very interested in ways that could support change. So that was a really good opportunity to bring together the city staff and the community belonging project team.
And I think if I may just kind of add to that, yeah, no, as part of that kind of policy impact forum, as a member of staff there, I left feeling very encouraged and just kind of hearing how different departments within the organization were, you know, actively, you know, taking in that feedback and, you know, taking in steps to making, you know, what we do and the services that we provide more approachable, more accessible. And so I think, yeah, that was very encouraging for me. And also I think just being involved in this project, you know, I'm so grateful that we have so many champions of this work within our community, both internal and external to our organization and the city of Powell River. And I think that is so important, you know, to continue having those conversations, to continue advancing that work. And yeah, no, super grateful for that and for the opportunity to be involved in this project.
Excellent. Thank you. I did just pop a question into the Q&A there from the chat. Sundance, do you want to take this one?
Yes, I am just waiting for it to load up here. So sorry, is this the one from Amelia or the one from yourself, Vanessa?
There's the one from myself is from Tammy. Excuse me, I just popped it in. I don't see the one from Amelia yet. So, oh, there it is. Okay, either one.
And so just for clarity, it's a little bit challenging for me to get into the very specifics on these ones here because I wasn't part of this process at the city when this all went forward there. So I'm going to be mostly throwing this over to Jason and Hugo to jump in on this one. But I would like to say from an organizational perspective, as someone who came in later in the process and see all this hard work that's been done, it's an important layer on what we do as a city moving forward, and it can be used on so many different platforms, whether it's in recreation, whether it's in planning, whether it's in engagement. We're in the process of redoing our municipal website, and so these are all things that feed into what we do as a day-to-day operations of the city. It's not just something that goes to one particular area of the city. So I've been almost a year, but as someone who's been at the city relatively new amount of time, it's an important building block to have for us moving forward here. So with that having been said, Vanessa's question was about key informant interviews were mentioned in the methodology. And she's saying, could you speak a little to what items, issues were examined or what the approach was when it came to examining internal processes? And so I'll throw this one over to you, Jason, and maybe you'll be able to speak to it a little bit in terms of what took place in terms of the examination for internal processes.
I think I might lean on the community belonging team a little bit here, but I can maybe give a good example, and I think it's one that a lot of municipalities are probably struggling with. I think the mention of financial pressures was brought up, but one of the bigger areas, of course, is our recreation complex and the programming that happens there for children And, I think the planning work that needs to go into establishing those programs happens in some cases a year out. And so you're kind of building budgets around thinking about those processes a year out. And so it was almost about establishing this conversation with our Parks and Rec team about, first of all, what are the challenges that some of these families are facing? Because I don't think that was clear. And so by doing so and then understanding, is this just a matter of staffing ratios, or are there other ways to provide opportunities that would allow children to participate in situations where they may not have been comfortable or able to in the past. And so I think just initiating that conversation, and I'm using that department because it seems quite obvious, and I think probably very relatable to many other municipalities, but similar questions were posed to transit and trying to understand, again, the day-to-day, and is it just a simple matter of needing more money, or were there other ways that could support better service delivery? And I think I'd offer that we don't have exact answers at this point, but I think it was the starting of those conversations so that the lens in terms of budgeting and planning for the programs is applied, like I say, at a year out, recognizing that we need to be making our budgets long before those delivery opportunities happen.
And also for the methodology question, I think a little bit of this is best addressed by one of our academic researchers. So Dr. Janet Newberry is actually on the call, and she can speak to that piece a little bit more in depth, I think, than we can. Thanks, Janet.
Thanks. And thanks for your presentation. It's really cool hearing you all talk about it from various vantage points. Sorry. Jason did kind of speak to the nuts and bolts of it, but I'll just back up a little bit as to why we began that way. So the community belonging team began by connecting with Hugo and Jason as the planning team, and Hugo and Jason helped develop a list of people from all departments throughout the city who we might want to talk to as a starting place, so that we weren't building a project based on our assumptions. We wanted to build a project based on their reality. And so meeting with the representation from Parks and Rec and communications, transit, planning, CFO, all different areas, was the very first step that we took before even doing the environmental scan, because it could help us understand where the opportunities are, where the gaps are, and where we should be putting our focus for this work. Hopefully that answers the question.
Yeah, thank you. And we've got a number. This is always the great part of these sessions is one question tends to spark other questions, and we start kind of rolling on a few different themes. So I see Mariko has added some comments in here, but the question from Malaya is, I would love to hear some of the key questions that facilitated the discussion with the city staff, if possible. So we have a collective representation here for our presentation. So I'll throw that out to anybody, and even yourself, Mariko, if you'd like to speak, or Janet and Tabitha, anybody there. So some of the key questions that helped to facilitate the discussion with the city staff.
Sure. Thanks, Vanessa. Hi, everyone. My name's Mariko, and I'm a senior policy lead in healthy public policy in population and public health for VCH. And having been involved in this project, the key informant interviews that we did with the municipal staff that Jason and Hugo sort of prompted us to speak with allowed us really to just open up a conversation about accessibility and inclusion of children with disabilities and their families. So I've put the prompting questions in the Q&A chat for anybody who'd like to refer to that. But I do want to share that overall, by just hosting the interview with staff, just created space for actually discussing their thoughts, their concerns, their curiosities, and their own wishes around more inclusion. And what I can honestly share with you is that by hosting conversations about accessibility, belonging, participation, and inclusion, I think that you will, like us, experience an overwhelming sense of compassion and desire by all staff across departments to actually be able to address greater inclusivity of these children and their families. The staff shared with us the many barriers and challenges that they experience through the structures and systems that they operate within, but their personal desires as culture and team members absolutely sort of passes by all of that to sort of demonstrate that they actually wish to do more to be able to facilitate this greater sense of belonging. With that, I think that the conversations did inspire some opportunities, and I've also acknowledged some previous efforts and current efforts. So some past efforts that staff shared were the Ricanson assessments that have really informed some of the infrastructure components for consideration. And then I know Gurmeet has posted in another question from the chat, but our Parks and Rec staff also shared with us that they really do rely on the community partnerships with other nonprofit organizations and or service agencies that do support children with disabilities, and that partnership creates a greater ecosystem to actually support the participation and use of the rec programming and facilities. I think what's important to note with the city of Powell River is that we reside in a territory that is remote, and so we are landlocked. You know, 2 ferries from Vancouver or a ferry from Vancouver Island or flight. And so there is no other community to kind of draw capacity from. And so I do want to acknowledge that in our rural community, there is only so much capacity. There are only so many community partnerships and staff collaborations possible across organizations. So one of the rec staff people very much highlighted that his experience in an urban center as a rec staff person was quite different from his experience in a rural setting where he can't quite draw from the sort of multitude of agencies to collaborate with, yet they find ways to be creative. And one of the great outcomes that came from some of our conversations is the rec and park staff experimented and piloted a swim session for children with extra needs that they wanted to accommodate by making adjustments in the pool dynamic to reduce sound and to make the sessions much more smaller and intimate with the staff that were providing the swimming instruction. So I hope that sort of touches on a couple of the questions there related to your curiosities around the key informant conversations and then the Parks and Recs considerations as well.
Thank you, Mariko. A couple more questions, and I see we've got one in the chat there from Brenda. I just want to pause to see if there's anything from any of our other presenters that they would like to add to those last couple of questions before we. Okay. All right. Sometimes I'll let you take the next one here too. You pick.
Okay. I'm just reading it as we go through. So so it says, in my community childcare center, licensing requires all childcare centers to have an inclusion policy and a template policy is provided. At the same time, there's a big deficit in financial support and availability of supportive childcare professionals. This is very discouraging for centers who have technically signed off on a policy on paper. I feel a systematic issue on the policymakers in general community feeling something has been addressed because it's stated in a policy, but in fact, a policy that is not able to adequately implemented in practice. So, you know, honestly, I think you're hitting on a very important thing, Brenda. It's one thing to have a policy and sort of realize that you've done it, but I think it was addressed earlier that really it's not just about having a policy, it's about doing actionable items and bringing it forward in the practices of the municipality. And it's a bit of a challenge in a municipality when you've got, I'll say, 1 million things coming at you all at once, but it's sort of embedding this into the thought processes and getting buy-in with the senior leadership team to not just check a box. So not much more I can add to that. Maybe others have more to say, but the point being that just because you have a policy doesn't mean you've advanced advanced anything, I think is a good thought.
Yeah. All right, a question in here from Albert. How did you involve your own accessibility advisory committee with the research?
I'm happy to take that one on. So there is like a lovely crossover, I think, that's advantageous in smaller communities. I actually serve as the chair of our accessibility committee, which is comprised of representatives from the regional district, the city of Powell River, and the library of Powell River. So we made sure to, like, me being there as the chair also served as like understanding how to do the systems navigation. And Dr. Janet Newberg actually came and did a presentation, and we asked them for feedback as a whole around the project and notified them the project was ongoing, and then made sure to share the final materials with them as well. So I mean, it's that piece, right, where engagement can always be improved and be better. But I do feel really proud that we were able to make sure that folks at the committee had the opportunity to provide feedback and were brought along with us as we move through the work.
Do you mind if I jump in? I'm curious, was that question about the committee or the parent advisors who are part of the community belonging team as well?
Ooh, answer that one too, though, Janet. I think that's a really good layer.
So the parent advisors who are part of the community belonging team were dynamite. They added so much value because they have direct experience and they're amazing advocates because they have to advocate so much for their families due to the systemic ableism that they encounter every day. And so we were very flexible with how we met. We sometimes met in person, one-on-one. We sometimes met on Zoom all together and everything in between. And they provided feedback on literally everything, or not just feedback, input into the design of everything and feedback on everything. That client services handbook that Hugo talked about that has like a one-pager that you can post next to your workstation as a staff, that was 100% their idea. The film was 100% their idea. Like, it was like, how do we make this actually implementable? So they just like came with a very like unwavering commitment, tons of knowledge, and great input at every step. And part of why the funding was so important was they got paid. So that's really vital as well.
And then the next question is from Amalia, and she says, budget constraints aside, one of the biggest challenges is when needs exceed what our recreation staff can realistically and safely support. I know this is an ongoing topic of concern with other municipalities, even with community partners being involved in providing supports. Did this challenge come up in any discussions or findings, and were there any other creative solutions proposed? So I'll throw this open to those that were at the table to get into the nuances of the discussions that took place at the time.
Yeah, I don't mind jumping in. Yeah, okay. Go ahead, Tabitha.
No, if I love it, Janet, go ahead.
I mean, I think this is why the step 7, circle back to the top, is so important, because we can't wait to get it right before we start. So that said, yes, your comment makes perfect sense and is very real. So the partnerships are really important. And also, like, a lot of the things that Tabitha presented that were like the bottom of the pyramid, like, we often focus on the top row, like implementing explicit changes, but a lot of the bottom stuff was culture shifty stuff. So having these conversations. And one of the additional wonderful things that came out of the Policy Impact Forum was just like informally problem solving. So people from the library were there and people from rec were there, and both organizations are doing a lot of good hard work in this area, and they were like problem solving in the moment. So getting people in the room, I think, is just part of the culture shift, and like people who are doing the work can can problem solve better than anyone else. I do think, related to the earlier question about funding, ongoing advocacy is also unfortunately part of this work as well. But one of the key things that stands out in my memory around this conversation was somehow reducing staff turnover, because, as was earlier mentioned, a lot of what contributes to accessibility, inclusion, and belonging is attitudinal and behavioral, and we can learn how to do things in a way that is more accessible without having to necessarily add infrastructure. The problem with programs like, for example, summer camps, is it's often students are hired one summer and then a different batch of students the next summer. And so if there are ways to build stability, then those investments in training go a lot farther, and not only training, but the mentorship of the newer people. And I know that earlier question in the chat was about early childhood education. I know that whole landscape has changed so much, and there used to be more sort of like in the workspace mentorship when it was like a more viable career probably for more people. But if there are ways structurally to create that on the job and reduce turnover, that's one way. But it does not fully address your question, that's for sure. I don't know if others have things to add to that, though.
I think if I may add to what you had just shared, Janet, and what I'm going to say now is also found in the summary report as well. But yeah, that piece about ongoing learning is super important. You know, how we present information and disseminate that through, you know, city websites, et cetera, is also very important. I think seeking feedback on services that we provide, and something that that was done as part of this project was also, you know, conducting an equity site visit. I was wondering if maybe the someone on the project team wanted to kind of touch on that very briefly, but I think that might be, you know, a shorter term solution to addressing some of those, you know, budget constraints as well.
Yes, this was another amazing thing that the project advisors did. They would go to city-run spaces and walk through with a list of prompts and questions from like the moment you arrive to like entering the building, going into the lobby, encountering a human being, trying to access the washrooms, like all like participating in the program, all of those steps, and documenting their experience of what worked and what felt like a barrier to participation. And the other thing that we learned through partnership with the library, and as well as an organization based out of Vancouver called Let's, which is really great, was if you can't provide an accessible service, be explicit about that so that people who need it don't have to dig and find out. So just being like super transparent about communication is like, we're working on it, we're doing our best. Here's what we can do. Here's what we can't yet offer. Can save parents and others a ton of work in trying to navigate their community.
Thank you. I'm just reflecting on our time here. We're quickly running to the end of our session and starting to see some notes with folks having to drop off for other meetings. But Erica just in the chat posted the link to the survey. If again, folks could take a couple minutes to complete that. It will not take you very long, and we'll also be circulating that link out with the information sheet that will accompany the resources that have been mentioned during this presentation and included in the chat, as well as a recording to the webinar as well. But I want to thank you all for joining us, and especially thank you to the Community Belonging Project team and everybody here with the City of Powell River who supported this really important work, and for taking the time to share this with colleagues and partners across the province and beyond. This is very applicable, very important information that I know is going to really resonate with other communities and practitioners across the province, and like I said, and beyond, and what we can be doing to better support and include children with disabilities and the ableism. So thank you you, Tabitha, Hugo, Jason, and also Mariko and Janet for jumping in and showing your support as well. And also Sundance, thank you for co-hosting this with me and allowing your team to join us and share your experiences.
Yeah, thanks, Vanessa, and thank you for leading this presentation today. And I guess all of this from the city's perspective, this is just the beginning, right? This is a spot in time as we advance and as we work to build and do things. As everyone knows, things don't stop. We keep building, we keep changing, and so this is going to be part of our thought process moving forwards. So it'd be interesting to check in at a future date and see what we've been able to accomplish as well.
Yeah, I echo that, and I think a lot of our participants would as well too, to see in the comments, thank you for this session. Please share more like this. Fantastic. That little is known about accessibility in BC amongst not-for-profits and other NGOs, and webinars like this are really one way to help improve this. So we would love to have you guys back at a future date to share some updates and how the work is going. Yeah, amazing. Thank you so much, everybody, and have a wonderful rest of your day and week, and a safe long weekend upcoming. And we will be in touch by email, but please feel free to reach out to us at any point as well with any follow-up questions. Thank you so much.
Thanks, everyone.